Dr. LaPook is going to join us every Tuesday to break down the top health stories of the day or check out whatever weird mole Tony may have on his shoulder.
Have you seen that? Did you notice it? Oh my gosh, my door was cracked this morning. Okay,
I didn't want to say anything before. But this morning, the doctor is going to be here to talk about, of course, the debate.
Yeah.
Because lots of Americans actually have a lot of questions about the debate and how each candidate will change, improve, hopefully, healthcare in America. It's a topic that a lot of candidates don't like to get into with details because it is complicated, Dr. LaPook. How complicated?
It's super complicated, and I wonder in 2 minutes, back and forth whether there's really enough time. But, I'd like to see tonight them address sort of, first of all, the big picture. And the big picture in the United States is we spend about twice as much as other wealthy countries for health care, and yet our outcomes are towards the bottom of the list.
Why?
When it comes to infant and maternal mortality, to lifespan, to deaths from heart attack. And, why? So it's very, very complicated, but I'd love to see them hit like 3 issues. One of them is health inequity. Black women are 3 times more likely to die from pregnancy-related illnesses as white women.
Isn't that crazy? And education doesn't matter, income doesn't matter, there's still that inequality.
Exactly. And then another big picture, which I'd like to hear what they have to think about our whole approach to healthcare, which tends to be reactive in the United States rather than proactive. So we tend to wait for people to get sick and then do something to them. They go in the hospital, we do costly procedures, et cetera, et cetera. What about prevention? What about the role of diet and exercise and mental health? That's something that's so important. The environment, how is that contributing? And then the last thing I'd love them to address was chronic underinvestment in our public health system. And we saw that on full display during the pandemic. I was in Oklahoma, and true story, I saw the fax machine that was being used to send requests for a COVID test from a doctor's office to the public health system because they didn't have secure, transmission.
But this is all so confusing to people because on the one hand you talk about underfunding, but on the other hand we're spending more than anyone else and getting worse outcomes. So what is it? Do we need more money or do we need more money better spent? What's going to fix this?
All of the above. And I think, the result of it is we're seeing a ton of people in medical debt. And I think that's what people really care about, the money in their pocket. Yeah. About 20 million people in the United States owe at least $220 billion, about 1 in 4 skip or delay health care because of that. And the first thing you have to look at there, they need to address the uninsured. 25 million Americans are uninsured. That number's only going up because the pandemic-associated relief in Medicaid, people got special coverage, that's expiring. So they're getting disenrolled. And at the same time, there are 10 states that are still not doing Medicaid expansion that's paid for, in large part through the Affordable Care Act. And you look at a map, and that same area are the people who are most uninsured and tend to have worse outcomes. And then finally, you have, in terms of people's pockets, you have deductibles. Deductibles, that's the amount of money you have to spend before your insurance kicks in. And that's an average of $1,700 a year for people.
It is so high. It is
crazy.
Like I call sometimes my insurance and I'm like, surely I've reached my deductible by now. And they're like, nope, keep going.
Yeah, and then there's the copay. We're going to pay part of it, but you have to pay the other part. It all adds up.
You pay some more. If you got an offer to work in an administration, would you take it? Clean up this whole mess. Dr. Jon LaPook, health czar.
No.
No, he says no.
Not in a million years.
All right, well, continue to come by every Tuesday and help us understand what we should call.
Honesty is the best policy.
That's great, Dr. LaPook. Your patients need you.
Your patients need you, and we'll make sure that we provide our viewers with what they should say to their representatives to say, fix this thing. By the way, in terms of what you should say, we have no bearing on what goes on in the debate tonight. You're talking about what you would like to hear. Right. I have no idea what they're going to talk about.
Very important. We specifically did not talk to anybody at CBS News about what the questions are going to be. This was all I did a deep dive for a couple of weeks, and it was really complicated. These are little nuggets that we got in terms of what I'd like to see.
They're in a bunker over there.
And that's also incredible, Dr. LaPook. You're a doctor, and it took you weeks to kind of decipher all of these issues with the problems of our healthcare system.
Not dissimilar to 2009, the Affordable Care Act. People didn't know what it was. It was like 1,000 pages. So very tough to understand all this, but important that we discuss it.